Hello friends. So today we will talk about the health sector in India. So you know that India spends about 1.3% on health sector of GDP. So if suppose the GDP of India is 100 rupees, India would be spending 1.3 rupees on the health sector. Okay. So this is not very good for a country. Actually, India should developing countries, if you see them, they spend more. For example, if you see Scandinavian countries, okay, so Scandinavian countries are those European countries. So Norway, Finland, Sweden, those are the Scandinavian countries. So Scandinavian countries, they spend around 9% of their health, and they are considered to be the best. To have the best medical infrastructure in the world. See, uh, when the constitution was made, so like the health was education, three lists were made: concurrent list, state list, and national list or union list. So now education is in the concurrent list. Okay, so that means center can also spend, and state can also spend. But if you see health is dominantly on state list. Okay, that means only state will spend on health. For example, agriculture is in state list. So for example, if you see health education, so if health is in the state list but education is in the concurrent list, so that means both center and state would be able to spend money on health education. But when it comes to accessing health facilities, then only state spends. That is why the total health budget of the country is low. So there are various panchayat promotion schemes, and you know that education was originally in state list, but then it was moved to concurrent list. However, what I feel like or people say is that health have moved should have been moved to like the union list or the concurrent list. Then education and health, both the health facilities would have both progressed and developed at a better pace. See, politics and policy should be separated. Okay, policy making is scientific, politics might not be scientific. Center should play a supporting role in healthcare. It generally plays, but to for a country to develop, centers should play the main role in healthcare. So this is where we are lacking. And the Bharat was like launched in launched to to fund from the center to the states. So had the health been in the union list or the concurrent list, then things like Ayushman Bharat wouldn't have been required. So this is where we lacked. See, Ministry of Health and Family Welfare, it is one of the oldest ministry. But don't you think that the Ministry of Health and Family Welfare is of much use? Shouldn't it be replaced? So also you have heard about the DOHR, that is Department of Health Records. It is also one of the oldest. Okay. So okay, so let us see, for example, MORTH, that is Ministry of Road Transport and Highways. Don't you think if accidents happen, so if accidents happen, so it is also a part of health, but transport is a part of union. So that part is in union, concurrent, or state list, all three. So this is where all the three sectors cannot be separated. And that just like GST is to GST Act, and NMC National Medical Council is to MCI Medical Council of India. 1956 is one of the important years of like India's history or post independence history. See, UGC was made in 1956, MCI Medical Council of India was made, and you know that reorganization of states happened. Andhra Pradesh, you remember? Okay. Actually, this video is about health. What you would be writing if a question comes on health? So, if I say that few committees to name with which are associated with health, the first would be the Yashpal Committee. Remember, Yashpal Committee is related to health. If a prelims question comes that write a short note on the health sector of India, or what are the issues India is going on primary or secondary or tertiary healthcare. So you can start your answer by writing as if Yashpal Committee. Okay, according to Yashpal Committee, so and so. Second committee which is related to health is National Knowledge Commission. Third is Parliamentary Standing Committee on Health. And fourth is Niti Aayog. Niti Aayog can be used anywhere. So something few sectors we need to like change. First is like NMC, National Medical Council. It was the functions were like to regulate medical education and medical profession. Second was to access health, human resource and infrastructure requirements, and third was to inflict admission criteria. Then there is something called next national exit test. So like just like the bar council of exam of law which you need to pass to practice in court, next is for students who are studying abroad. They have completed their MBBS and want to practice in India, but next is a very tough exam. It is said that people of who have like cleared aims during the undergraduate level sometimes and a lot of times find it very difficult to clear the next exam. So the question arises that India spends only 1.3% on health sector, and after that, on behalf of that, should an exam like next be there, national exit test, where only 10% of people pass? So these are some issues related to health. So so a law was made like final year MBBS exam will be the next exam. So limited license to community healthcare practitioner. So after this thing was made that final year MBBS exam, if you pass the next exam, and final year MBBS exam was made common to the entire country. So this is where we succeed. Then there is something called ASHA, accredited social health activist, and CHCP, community healthcare providers. So you can write an exam about these all things. Paramedics is something where we need to develop, like if you are going in ambulance, if someone has suffered accident, so don't you think that ambulance should also have doctors or some support staff? For example, if your home is like 20 kilometers away from hospital, don't you think that if there is traffic jam, the person may die within that 40 minutes, or his condition may further get deteriorated? There that is called paramedics, where you provide first aid within the ambulance. So people should be trained in that manner. So these are like some of the ways through which we can improve the health sector in India. So that's all for today, friends. I hope you understood it. Thank you and have a nice day.